So getting into the first bit of this, which is the final vessel in our circulatory system. And the lymphatics are not always, recognized as a part of the circulatory system, but they are an accessory to our circulation and our circulatory system. And we talked about how there's that connection of the fluid that ends up in our interstitial space being absorbed into the lymphatic vessels and then eventually making their way back into the circulation via the veins. So there is a connection between lymphatics and our vasculature and the circulatory system in general. So the structures that are involved in the lymphatic system are essentially vessels, nodes, organs. We have lymphatic capillaries. I'm sure you've all had an experience with swollen lymph nodes, and those are the nodes that we're talking about, those lymphatic clusters or aggregates, okay? We also see vessels that return these excess filtrate to the circulation, okay? So essentially there's an open communication between our capillaries and the interstitial fluid because of that exchange we described previously. And then from our interstitial fluid, it goes right back into the venous system to absorb that excess fluid. Lymph is going to move from capillaries to veins, and then it's going to end up draining into our thoracic duct, and then that drains into the right atrium. Okay, now some books will tell you right atrium, but more anatomically correct, it's actually the jugular vein. So the connection between the jugular vein and the subclavian vein at the neck region, that's probably the more anatomically correct region, but some other texts will tell you that it just goes into the right side of the heart, okay? As far as this course, we're gonna appreciate it as the right atrium in terms of an exam or anything. So then lymph is moving through our lymphatic veins, again, being picked up from the interstitial fluid from our tissues, moving through those lymphatic veins. It eventually aggregates into some of those larger lymphatic vessels, which are called the thoracic duct. And the thoracic duct is a single vessel. It runs right up through the abdomen. We're actually going to talk about it in our next unit in the anatomy lab. And then it's going to drain into the left side. Now, the entire right side of your body drains into another vessel altogether. So I'm getting a little bit into the details of the anatomy here in terms of that thoracic duct, but we'll talk about that in the lab, but I really want to understand that there's two components to the drainage happening. So eventually that fluid gets back into the heart and back into the circulatory system. Now, the lymphatic system also plays a role in our immune system as well. We've got cells like macrophages that are clustered in those lymph nodes. This is why if you have an infection somewhere, if you have an infection or bruise in your lower extremity, you may see the lymph nodes in your groin or the lymph nodes in your axilla or your neck region, aggregate as those macrophages begin to create an immune or lymphatic response, right, an inflammatory response. So this is what that connection looks like between the vasculature and the lymphatic system. So essentially we have exchange of fluid happening at the capillary beds. Fluid moves out into the tissues. That fluid is then sent to the lymphatic capillaries. The lymphatic capillaries will then aggregate towards lymphatic vessels. Now, these vessels also have valves, right? Like the veins, they're moving against gravity in some instances, and so they want to prevent any backflow and keep that blood flowing in one direction. And so we also see valves present in these lymphatic vessels. They then will aggregate, culminate together into that main duct that I talked about, the thoracic duct, and then that will eventually communicate into the venous system via the heart, right, the right side of the heart.